If you have endometriosis and you're considering using diet to help with your symptoms, this is a must watch. I'm Dr. Kim Sommerville, your general practitioner and clinical nutritionist, and this is Simple Summer Naturals. So if you have endometriosis or you've ever heard of endometriosis, it is a chronic disease that affects women who have menstrual cycles. What happens is that the lining of the womb or the uterus that usually sheds off during a menstrual period is now found in other areas of the body. This can be the walls of the uterus, it can be through the fallopian tube, it can be in your ovaries, sometimes even in your lungs and colon as well, causing many symptoms. I'm going to put some pictures here so you can get what I'm talking about. Some of these symptoms are pain during intercourse, extremely painful periods, pain even on defecation, and for some persons who may have these endometrial lining in their lungs, they may be even coughing up blood or passing blood if the endometrial lining is in the colon. So of course, as you can hear, it is a very debilitating disease. It happens and it allows women to sometimes not be able to go and do their daily activities. So because of that, a lot of women try to find alternative methods to treat their endometriosis. I've done my research into diet and endometriosis, and what is apparent is that there are very limited amount of studies, and when you do find the studies, they typically have a lot of bias. And what I mean when I say bias is that we're not really sure if these results are very accurate just based on the methods that the researchers used when they found out their information. So just take all of these with a grain of salt. And if you do want to try any of these diet tips, definitely speak to your doctor or nutritionist before starting anything, because if we take out or add in things, they can affect our bodies in ways that we may not be able to control on our own. So please speak to a professional. First one I'm going to be discussing is the Mediterranean diet. So if you've been on my channel before, you've likely heard me talk about this, just because based on the type of products that they have in this diet, it tends to really reduce inflammation for most persons. So a study was done, a very small study at about less than 100 women, actually used Mediterranean diet for about 5 months. And what was found, I'm going to be looking at a paper just now. So what was found was that they have decreased general pain, decreased severity of their menstrual cramps, and also reduced the pain during sexual intercourse as well as defecating. Now, of course, this would be wonderful for women if this was the case all the way around, but we can't generalize with a very small study. But I did feel that this was important to discuss. In a Mediterranean diet, what generally happens is that we increase the amount of vegetables, fruits, white meat, fish, and whole grains, as well as nuts, seeds, and beans into the diet because they tend to reduce inflammation. We also want to reduce the pro-inflammatory foods like fried foods, pastries, ice cream, red meat as well, so that when we actually balance this diet, we tend to notice a reduction in inflammation, which was found in the study with endometriosis. So I felt that this was important. If you do try it out, of course, speak to your doctor first. The next 2 dietary plans that I'm going to be discussing when it comes to improving endometriosis symptoms and signs are really similar to the Mediterranean diet. It's just that they're now separated into 2 different components. So the first component would be a high antioxidant diet. And most of the time that includes colorful foods. If you're looking at your plate, you want to know that you're seeing an array of colors. That's essentially how you'd want to know if you're getting a lot of antioxidants. So for example, foods that are red. You have tomatoes, you have watermelon. These tend to have a lot of lycopene. Foods that are purple, you can have grapes, blueberries, blackberries, red onions, red cabbages. These tend to have a lot of anthocyanins, which helps inflammation as well. You then go to beta carotene, which of course we know that comes in carrots, orange foods like cantaloupe, papaya, and even spinach, even though it's not orange. And you have also something called quercetin, which are usually found in teas, mostly in green tea, black tea, as well as red wine. So once you have a lot of antioxidants or a very colorful plate, this may also help improving your symptoms of endometriosis. And the next component is diet rich in omega-3s. I talk about fats a lot because, diet culture tells us that fat should be taken out completely, but that's not the case. Once you find good fats, then of course that will help in your hormone production, and you likely will also reduce endometriosis when it balances your estrogen production. So foods that are very rich in omega-3s are not actually very hard to get. Cod liver oil, if you're in Jamaica as a child, likely you've had cod liver oil before. Sardine, mackerel, pear, chia seeds, flax seeds, any type of fish, usually salmon, and even walnuts as well, are pretty rich in omega-3s. So if you can add these to your diet, at least having one of these components probably, or one of these foods rather, at least twice a day, that may help in terms of the symptoms that you find. Also, I just want you to remember that anytime you're getting into a diet change, specifically to relieve some symptom, it's going to take some time. A lot of the times when we look at the studies, it's usually at least 2 to 3 months and sometimes even a year that they're doing this research on the patient. So give it at least 3 months of you being consistent with it. Of course, you may fall off a little bit, but consistency matters. I hope this was helpful. If you do have anything that you have done for your endometriosis and you can share with the community, please do so. Please add them in my comments. I would love to hear about them, and of course I will do some further research too to see if that works for other persons. If you would like to work with me to improve some of your symptoms for either endometriosis, polycystic ovarian syndrome, or just to improve your weight and blood sugar management, please just contact me at my information here. So this is Simple Summer Naturals, giving you simple nutritional advice to improve your daily life. Take care.